Hi, everybody. I'm Dr. Ardis. This is the Dr. Ardis Show. Happy New Year. Happy 2024. Today's show is going to be all about reversing thyroid disease. Did you know that all thyroid diseases, including hypothyroidism, hyperthyroidism, Graves' disease, Hashimoto's, and thyroid cancers, all of them have quadrupled worldwide in the last 50 years, actually, the last 49 years. Did you know that? Well, millions of people around the world are struggling with thyroid diseases and disorders. And I'm going to actually tell you and show you a presentation on how I, Dr. Brian Ardis, with research to back it all up, have actually what he's used, what I've used for the last 20 years to help people improve their thyroid function, reverse their thyroid diseases, and how it is you can start doing that also. Also, this information I encourage you to share with all your medical doctors that are prescribing you drugs that don't correct anything. All right, we're going to be right back after these messages. I'm Dr. Brian Ardis. Welcome back, everybody. I'm Dr. Brian Ardis. This is the Dr. Ardis Show, and this segment is being brought to you by two of Dr. Ardis's products. So at the drardisshow.com, you can find a product called Iodine from kelp. Also, you will find what's called Selenium, which is a mineral, if you can see it. Selenium. All right, so these two products, Selenium and my Iodine product of the Dr. Ardis Show, are the sole sponsors for this segment of the Dr. Ardis Show. And I'm going to take you through a presentation on how to best reverse and beat thyroid disease. And these are things your medical doctors are not going to tell you. But I'm about to show you what the world knows, what the medical profession should know, and what medical doctors and your endocrinologist and hormone specialists should be studying and recommending to you to do every single day. And those basic recommendations should include selenium and iodine at the bare minimum. But what you're about to see is that the majority of all Americans are never even told to take either one of these supplements that are proven to be what the thyroid needs to make adequate thyroid hormones and keep your thyroid the healthiest size. Some people get enlargements in their thyroids or goiters. All of those can be prevented with just these two supplements. And so we're going to take you through that here. These are one of the reasons why I released these over the last 4 years, is to help people address their thyroid concerns. All right, so I'm going to pull up my presentation. It's time to take you through my PowerPoint because I love showing, not just telling. I don't just speak it. I like to show you. So hopefully you can follow along. Hopefully I've made this very simple. If there's anybody out there who has any of the symptoms we're about to share with you, we're going to first define what thyroid disease is, what the thyroid is, where it's located, and what it's responsible for. And then what are the symptoms that would tell you that you yourself or a loved one of yours or someone you know may actually have thyroid issues or imbalances also, and you might want to recommend those two supplements I just showed also. All right, so here we go. Or at least tell them to watch this show at a bare minimum. All right, so here we go. This is the Dr. Ardis Show, reversing thyroid disease. All right, just to get everybody acclimated, in case you didn't know, the thyroid is actually located in your neck. You can see it on the screen. You'll see it highlighted on the left side of the screen, and then you'll see a drawing, really, of what the thyroid and other structures it's close to, where it is. It's just below the area on a man called the Adam's apple. It's just below what's called the thyroid cartilage. You'll see it in red on both of these images. You'll see the thyroid gland, the thyroid cartilage. You'll see there's a right lobe and a left lobe of the thyroid. And then you'll see the isthmus, which is this little indenture on the bottom of it. And then it's right in front of your windpipe called the trachea. Just for anatomy reasons, you should at least know where it is. And that's where it is. It's located at the bottom of the front of your neck on every human. Let's review some of the signs and symptoms of what is called an underfunctioning thyroid, or what is called hypothyroidism. I'm going to read along here on this graphic. The signs and symptoms of an underfunctioning thyroid vary depending on the severity of the hormone deficiency. Problems tend to develop slowly and often over a number of years. That is very true, but it can be very sudden also. So let's just look at the list, because you might struggle with some of these things, or someone you love is struggling with this, and you might just look at this list and go, you know what? This sounds just like me, or it sounds just like my loved one. I should tell them to watch this show and maybe go get this stuff tested. I'm going to show you what they should go looking for. Signs of an underfunctioning thyroid include fatigue, drier, itchier skin, feeling cold, feeling of pins and needles in the hands and feet, hoarse voice, constipation, hair loss, mild weight gain and difficulty losing weight, difficulty concentrating and poor memory, impaired hearing, menorrhea, shortness of breath, puffiness around the face, hands, and feet, slow heart rate called bradycardia, delayed tendon reflex relaxation, carpal tunnel syndrome, that's wrist and hand pain, serious cavity effusions, peripheral edema, that's leg swelling, hand swelling, ankle swelling, knee swelling, diffuse alopecia, that's hair loss, and dry, coarse skin, cool peripheral extremities. My hands and feet are always cold. That's hypothyroidism. That's an underfunctioning thyroid. Now let's look at symptoms of hyperthyroidism. That includes fatigue, muscle weakness, problem sleeping, an irregular heartbeat, rapid heartbeat, unit. And now I want to stick with these two, by the way, regular heartbeat, irregular heartbeat, or rapid heartbeat. I mean, if you have those symptoms, aren't you going to be referred to a cardiologist because you think there's a heart problem? Did you know your heart problem could actually be a thyroid problem? This is why you watch the Dr. Ardis show. Unintentional weight loss, meaning you're just losing weight and you have no idea why. This is an overactive thyroid. Increased sensitivity to heat. You get really irritable, angry when you're in hot situations. Mood swings, hand tremors. How many people have been told they have Parkinson's because their hands are trembling and it might be a thyroid problem? Diarrhea or more frequent bowel movements, excessive sweating, muscle twitching, brittle nails, redness in the palms, bulging eyes, changes in the menstrual cycle, increased hair loss, skin thinning, goiter, irregular menstruation. Now, you'll see a lot of these overlap, so it's kind of difficult to tell. So how are you going to tell? However, if you're dealing with any of these issues, you should know and be educated on the thyroid and be able to have a confident conversation with your medical professional or healthcare professional about your thyroid. I just liked this image, and I thought this was funny. Hyperthyroidism. Look at this lady with a fan trying to cool off. I think it's funny. These individuals typically have an intolerance to heat. Their hair is fine and straight, bulging eyes, facial flushing, enlarged thyroid, tachycardia, changes in your heart rhythm, systolic blood pressure elevated, breast enlargement, weight loss, muscle wasting, localized swelling, menstrual changes, diarrhea, tremors, and finger clubbing. Fingers are getting fat. Now, this is actually a website that's talking about thyroid cancer. So now you have underfunctioning thyroid and overfunctioning thyroid, and you can also have what's called thyroid cancer. Now, I want to just read some of these to you because some people may not know this information. I think it's important for you to know. There's only so many things that go wrong with your thyroid. You can either have an underfunctioning thyroid, an overactive thyroid. You just saw the symptoms, or you could have cancer. So let's go into what that looks like. Thyroid cancer, I'm going to read this paragraph and y'all follow along. Thyroid cancer often presents as a lump or nodule in the thyroid and usually does not cause any other symptoms. Blood tests generally do not help to find thyroid cancer, and thyroid blood tests such as TSH, that's abbreviated thyroid stimulating hormone, are usually normal, even when a cancer is present. Neck examination by your doctor is a common way in which thyroid nodules and thyroid cancers are found. So what if your medical doctor's not touching you? Often thyroid nodules are discovered incidentally on imaging tests like CT scans and neck ultrasounds done for completely unrelated reasons. You may have found a thyroid nodule by noticing a lump in your neck while looking in a mirror, buttoning your collar, or fastening a necklace. Rarely, thyroid cancers and nodules may cause symptoms. You may complain of pain in the neck, jaw, or ear. If a nodule is large enough to compress your windpipe or esophagus, it may cause difficulty with breathing, swallowing, or it might cause a tickle in the throat sensation. Even less common, you may develop hoarseness if a thyroid cancer invades the nerve that controls your vocal cords. Cancers arising in thyroid nodules generally do not cause symptoms, and therefore function tests are typically normal, like blood tests, even when you have cancer. The best way to find a thyroid nodule is to make sure that your doctor examines your neck as part of your periodic check-in. Can you imagine all the things you'd have to remind your medical doctor to do as I teach you stuff? You're going to have to make sure if you're curious, hey, doc, check out my thyroid, touch it before you walk out of the room. All right, now this is important for my audiences. Why? Because I know the age demographic of a lot of my audiences. This is actually straight off of American Thyroid Association's website. Older patients and thyroid disease. Definition: what do the following patients over the age of 60 years old have in common? And I'm going to read through this list of questions because I want you to consider, is this you, or do you know somebody who has these conditions? Maybe it's your grandparents, maybe it's your parents, maybe it's you. So here's some examples. A 72-year-old woman with fluttering of the heart and vague chest discomfort on climbing stairs. An 80-year-old man with severe constipation who falls asleep often. All of these scenarios have something in common. A 65-year-old woman who has lost strength in her legs, causing difficulty in climbing stairs. She has recently lost 15 pounds in spite of a very good appetite. And a 75-year-old woman who had developed difficulty swallowing and a dry cough, accompanied by hoarseness, weight gain, and dry, itchy skin. Or a 78-year-old man with hearing loss only. How about an 84-year-old woman in whom a hand trimmer has caused her to give up favorite activities like, could be cross stitching or knitting, crossword puzzles. She is so depressed that she will not eat, and she has lost 12 pounds in the last 4 months. All of these patients have abnormal function of their thyroids. Now, pay attention to that. You've got weight loss as an issue, itchy skin as an issue, hearing loss as an issue, fluttering of the heart. These are not able to fall asleep. These are all issues related to or falling asleep too often. These are all signs or symptoms of a possible thyroid problem. Patients 1, 3, and 6 have over-functioning thyroids. 1, 3, and 6. 1 was fluttering heart. 3 was developed difficulty swallowing. 6 was gave up her favorite activities because of hand trimmers. And then patients 2, 4, and 5, which is 2 is 80-year-old man with constipation, falls asleep all the time. 4 is difficulty swallowing, dry cough. And then 5, sorry, I messed up, but 5 is a 78-year-old man with hearing loss or reduced production of thyroid hormones. All right, so these are just some symptoms I want you to consider. Maybe you have these issues. Now let's look at the incidence of hypothyroidism prevalence in the United States. This is from 2023, top left. You can see the words Journal of the Endocrine Society. Endocrine means hormone glands. So this is a Journal of the Hormone Gland Society. Their article from 2019 by Kathleen L. Wine. Actually, this was published in 2023, but a collection of information from 2009 to 2019. Title of the article, Hypothyroidism Prevalence in the United States. This is a study combining National Health and Nutrition Examination Survey and claims data from 2009-2019. In the very first paragraph of this paper, you read, abbreviated HT is hypothyroidism. Hypothyroidism prevalence remained around 9.6% in the U.S. population. This administrative claims data showed that hypothyroidism and underfunctioning thyroid prevalence grew from 9.5% of our population in America in 2012 to 11.7% in 2019. And in 2019, they published that over 78%, that's 80% of all patients received thyroxine T4 monotherapy. Now, I'm going to focus on this for just a second. We're going to come back to this statement. Just remember, 80% of patients receive thyroxine T4 monotherapy. 80% of all Americans with underfunctioning thyroids are singularly given this one drug only for treatment. Similarly, this other data set, abbreviated NHANES, showed that T4 replacement therapy, which is called thyroxine above, in the statement above, was the most common treatment for hypothyroidism. From 2012 to 2019, patients with untreated hypothyroidism grew from 11 to 14%. The prevalence of hypothyroidism in the United States has steadily increased since 2009. Likewise, the percentage of hypothyroid diagnosed patients not receiving treatment also increased, suggesting that the increased prevalence may be due to increased cases of subclinical hypothyroidism. By definition, subclinical hypothyroidism, if you ever see the word subclinical, that means you're not aware something's wrong. So you don't feel it, you don't see it, you can't tell if there's anything wrong with you. Subclinical means you're going to your doctors, they don't have a clue because you're not telling them there's something wrong. But there's a lot of people who have underfunctioning thyroids who aren't aware there's a problem yet. Remember, I said I'm going to stick with this one statement. 2019, 80% of patients received alone thyroxine T4 monotherapy. This on the screen is the drug called thyroxine. It looks like this. This is what the doctors are giving out. What does the word monotherapy mean? I went to the Webster Dictionary to find out. I put it in blue on the screen. Monotherapy means the use of a single drug to treat a particular disorder or disease. So when we go to that statement, 80% of all Americans are only being given this drug for an underfunctioning thyroid disease called hypothyroidism. and you're going to realize what's the problem with that here in just a minute. And this is when you realize that the medical profession is not watching the Dr. Ardis show, because I'm about to show you that there's 4 minerals alone that are proven to reverse hypothyroidism. And 80% of all MDs are not telling their patients about it, per this research paper from last year, 2023. All right, now we're going to go to this next article, or continue in this thyroid study. First sentence, highlighted in blue. I'm going to read it. Everybody read along. It has been reported that iodine deficiency and severe selenium deficiency may cause an increase in a hormone called TSH and leads to a deficient thyroid volume. So the size of your thyroid will change as a result of a iodine and a selenium deficiency. That's interesting. I just showed you a statistic that 80% of all medical doctors are only giving a drug, prescription drug, for an underfunctioning thyroid. However, the same studies talks about, it's reported that iodine deficiency and severe selenium may cause an increase in TSH levels and thyroid volume. I want to show you this because I want people to understand what TSH is. TSH is abbreviated thyroid stimulating hormone, as it's underlined in red on the screen. And then I'm going to continue. For those of you who are wondering, if you got blood work at home and you'd like to look and see, does your TSH say anything about you? Or is your doctor checking this? TSH, which stands for thyroid stimulating hormone. TSH levels higher than 4.5 usually indicate an underactive thyroid, and then you'll be diagnosed with what they have abbreviated in blue, hypothyroidism. And low TSH levels below 0.4 indicate an overactive thyroid called hyperthyroidism. All right, so that's what TSH is. In this article here, it says it's been reported that iodine deficiency and severe selenium may cause an increase in TSH levels. So let's go to this paper here. This article, the first sentence in red, TSH levels that are higher than 4.5 indicate a hypothyroid. This article here, it's been reported that iodine deficiency and severe selenium cause an increase in TSH, leading to a diagnosis of hypothyroidism. Just want to make sure it's clear. Hope everybody got it. Do you know what organ makes the thyroid stimulating hormone? I have it underlined in red. It's created by a pituitary gland. What's the pituitary gland? It's in your brain. You'll see it squared off in red. They're pointing an arrow over to your brain. That's the pituitary gland. It's also called the master hormone gland. On this chart, you'll also see in red the thyroid. You see an arrow going to that. The thyroid's in your neck. But look what organ makes TSH, thyroid stimulating hormone. It's the pituitary gland. Now, I'd like to ask everyone watching the show, if this is as perplexing to you as it is to me, why do they look at blood work to diagnose TSH to be an indicator for a thyroid's function when the thyroid doesn't make TSH? Your pituitary gland does. In fact, the pituitary gland and your thyroid are 2 totally different organs. The thyroid, as you see underneath the red box on the screen, you'll see 2 hormones the thyroid makes called T3 and T4, abbreviated. That's what they look for to see how much T3, T4 is the thyroid making. Isn't it weird that the medical profession primarily looks at TSH to diagnose an under or over functioning thyroid? I think it's weird. Why aren't you looking at the thyroid? Why are you looking at the pituitary gland? It's a pituitary hormone, not a thyroid hormone. So they're already screwed up in their diagnosing, looking at the TSH levels. In Denmark, a researcher named Rasmussen reported that low serum or blood selenium concentration was associated with a higher risk for an enlarged thyroid gland and for the development of thyroid nodules. Wow. Did you know that? I wonder if your MDs know that. That selenium deficiency in the blood leads to thyroid goiters and an enlarged thyroid gland. In this study with 6,000 participants in China, 3,000 individuals were included in the area containing sufficient selenium in their diet and in the ground. And 3,000 of the people in this study were included in the areas containing low selenium in their diet and in the ground. And the prevalence of thyroid diseases among those regions were evaluated. So they took 6,000 people, 3,000 of them lived in an area where they got plenty of selenium in their diet, the other half didn't. The prevalence of thyroid diseases, including hypothyroidism, subclinical hypothyroidism, meaning you're not aware you have a problem yet, autoimmune thyroid diseases, and diffuse or a whole lot of goiters, was higher in the group involved in the lower selenium containing regions. So the 3,000 patients who were not getting selenium enough, they had the worst thyroid diseases outcomes. Continuing in this same paragraph, In our study, selenium levels were significantly lower in patients with nodular goiters, as reported in previous studies. Selenium deficiency is associated with a higher prevalence of thyroid disease. Notice that's not a question or a theory. It says, as reported in previous studies, selenium deficiency is associated with a higher prevalence of thyroid disease. Zinc is one of the trace elements in the human body. The relationship of this element with thyroid is that the thyroid hormone binding transcription factors involved in gene expression all contain zinc. So the hormones your thyroid releases and creates contain zinc. A study reported that free T4 and T3 levels were significantly lower in patients with goiters and zinc deficiency. I mean, these medical doctors, 80% of them that are only giving a prescription drug, do they not read research studies? They tell you that these studies confirm zinc deficiency and selenium deficiency leads to thyroid disease. Here's the conclusions of this study. Low blood levels of selenium and zinc levels may be related to the thyroid nodule formation. In regions with or without iodine deficiency, along with adequate iodine intake, adequate intake of selenium and zinc may prevent the formation of thyroid nodules. Due to its anti-cancer properties, keeping the selenium level within the normal range may have a role in preventing the development of thyroid cancer. This is why selenium and my iodine product at the Dr. Ardis Show are sponsoring this episode. Here's my selenium product at the Dr. Ardis Show. I actually increased our new formula that just got released this week. I haven't updated it yet on this slide. We now have 200 micrograms in each capsule. Thank goodness. I increased it because this is what we need. You'll see 100 micrograms in our selenium product, along with pea powder, lentil powder, millet flour, and chlorophyll that has a little bit of copper in it. I want to show you this before I go to break. This actual research study is called Selenium and Thyroid Disease. And I'm going to read this statement. In the thyroid, selenium is required for the antioxidant function and for the metabolism of all thyroid hormones. Regarding thyroid disease, selenium intake has been particularly associated with autoimmune disorders when you're not taking enough. The literature suggests that selenium supplementation of patients with autoimmune thyroiditis is associated with a reduction in anti-thyroid peroxidase antibody levels. These are the antibodies that attack the thyroid. Selenium supplementing reduces those antibodies, and it improves thyroid ultrasound features, which is the size of the thyroid, and improves the quality of life of the patient. Selenium supplementation in Graves' disease, eye problems with the thyroid, is associated with an improvement of quality of life and eye involvement, as well as delayed progression of ocular disorders, eye disorders. The organic form of selenium seems to be the preferable formulation for supplementation or treatment. Isn't that amazing? How many people are being told selenium is going to do that? Conclusion of this study about selenium and thyroid diseases. Maintaining a physiological concentration of selenium is a prerequisite to prevent thyroid disease and preserve overall health. Are your medical doctors telling you that? Even though it's in their documents. Supplementation with the organic form is more effective, and patients with autoimmune thyroiditis seem to have benefits in immunological mechanisms. Your immune system also improves. Selenium supplementation proved to be clinically beneficial in patients with mild to moderate Graves' eye disorders. So, we're going to be right back after this break. Remember, this segment's being brought to you by the Dr. Ardis Show's iodine and selenium supplement. We'll be right back. Welcome back to the Dr. Ardis Show. I'm your host, Dr. Brian Ardis, and the sponsor for this segment of my special presentation on how to reverse thyroid disease is being brought to you by my product, Zinc Plus. Wish you could see it better. Zinc Plus, and then also our Thyroid Complete product. These four products, iodine, selenium, zinc plus, and thyroid support at a bare minimum are what you need. And these four minerals we're going to show you and continue to show you have been proven over and over to help reverse all thyroid disorders. All right, so on the screen, you'll see selenium and thyroid disease. We just concluded these statements about selenium helping to prevent Graves' disease and thyroid goiters. All right, now we're going to continue on. This is the Zinc Plus product that I just mentioned here. Zinc and copper are the first two ingredients I wanted to show you are on here, are in my Zinc Plus product. This is a paper from 2013. You can see at the top left is the date. You'll see highlighted in blue, zinc deficiency is associated with hypothyroidism, an overlooked cause of severe alopecia. Alopecia is hair loss. Any of you struggling with severe hair loss, you should know zinc deficiency and hypothyroidism could be the cause. First sentence in the paper, hypothyroidism is a common and well-recognized cause of diffuse hair loss. Zinc and other trace elements such as copper and selenium are required for the synthesis of thyroid hormones. Let me read that again. Zinc and other trace elements such as copper and selenium are required for the synthesis or making of thyroid hormones, and deficiencies of these can result in hypothyroidism. Isn't that weird that 80% of medical doctors are only prescribing a drug for hypothyroidism? You might want to educate them on what they're not learning in med school. That's why I put zinc and copper in this product, because they're required. Now we're going to go to my Thyroid Complete product. It contains 900 micrograms of iodine from kelp. It also contains 4 ingredients, and I'd kind of like to talk through why I have them in there. First one, underneath the blue highlighted iodine from kelp, you'll see raw thyroid concentrate of 60 milligrams. Why do I have these 4 animal-derived organ tissues in my supplement? But there's a reason for that. Did you know in order to reverse an autoimmune disease of the thyroid, in the case of a Graves' disease patient or Hashimoto's thyroid patient, do you know you have to use a thyroid extract to reverse the autoimmune disease? In order to get the antibodies out of the body that are attacking the thyroid, you have to put thyroid concentrate or some extract of thyroid into the intestines where your immune system is to send the antibodies that are attacking the thyroid to the gut and help you excrete that through your bowels, the antibodies that attack you. Now, in the thyroid scenario, it's called thyroid peroxidase. This is the antibody your medical doctors are looking for that are attacking the thyroid. If that's elevated, you had better be on a thyroid concentrate product of some sort. This is in my Thyroid Complete. Then you see raw adrenal extract. Why? When there's a thyroid dysfunction, your adrenals are actually controlled by your thyroid signaling. So when your thyroid releases T3, T4 hormone, those hormones tell the adrenals how much adrenaline and cortisol to release. When your thyroid's underfunctioning or overfunctioning, you're getting incorrect signals to the adrenals. And many people experience adrenal fatigue, adrenal burnout. You need to feed your body adrenals DNA genetics to actually improve the adrenal function. Your pituitary gland, raw pituitary gland. Remember, all your hormone glands communicate with each other. So this is why we have the pituitary gland in there. And then the spleen. I don't know if y'all know this. The spleen is the largest lymph node in the body. The spleen's its entire role is to detox your body of pathogens, disease, incorrectly defined antibodies called autoimmune antibodies, that helps to remove all of that stuff from your blood and from your lymph. And the spleen is on the left side of your body, largest lymph node in your body outside of your tonsils. Then you have thousands of lymph nodes all throughout your body, in your groin, in your armpit, breast, you name it, everywhere. You have lymph nodes connected by lymph vessels. We include all these ingredients there to help support the main 3 hormone glands, pituitary, adrenals, and thyroids, and the spleen's ability to detox what's causing disease. Now, remember, this product is called Thyroid Complete. You've got iodine on there from kelp. Now I want to show you this study. This is from 2015, titled Iodine Deficiency and Thyroid Disorders. Now, just so you're not getting overwhelmed here and trying to keep track of everything, there are 4 minerals: iodine, copper, selenium, and zinc. When those are deficient, you develop all thyroid disorders and cancers. So I'm just hammering on the evidence supporting these 4 minerals, why it is you and anyone you love who has a thyroid dysfunction should be on all 4 of these no matter what. All right, so iodine deficiency and thyroid disorders. Let's read the first sentence. Iodine deficiency early in life impairs brain development and the growth of the person. But iodine status is also a key determinant of thyroid disorders in adults. Severe iodine deficiency causes goiters and hypothyroidism. Isn't that weird that hypothyroidism, medical doctors, 80% of American doctors are prescribing a drug called thyroxine to manage hypothyroidism, when in fact iodine deficiency, zinc, copper, and selenium all are proven that if you're low in those, you develop hypothyroidism. You do not have a thyroid dysfunction because you're deficient in a drug. you do have all thyroid problems because you're deficient in zinc, found in the soil and in your food. It's supposed to be copper, iodine, and zinc, all of which are in the dirt drawn up into your plants. The last sentence in this study reads, thus, optimization of population iodine intake, the whole population of America should be taking iodine, is an important component of preventative health care to reduce the prevalence of thyroid disorders. Thyroid disorders are 4 times greater than they were 50 years ago in America and worldwide. The number of people with thyroid problems. Isn't that amazing? That if we made sure the entire population was consuming enough iodine alone, they say here, is an important component of preventative health care to reduce the prevalence of thyroid disorders worldwide. Now, we're going to dive into this because it's important. I need to give you an alert about thyroid cancers. This is your warning. This is in the journal Diabetes Care, volume 46, issue number 2, online. In blue, you see highlighted GLP-1 receptor agonist. These are a type of drug, and the risk of thyroid cancers. All right, so the first questions out of your brain as you're watching and reading this and hearing this should be, what in the world is Dr. Ardis talking about? What is GLP-1 receptor agonists that increase the risk of thyroid cancer? I'm glad you asked. In this article is this document from the American Diabetes Association. The use of, reading the title, the use of GLP-1 receptor agonists is associated with an increased risk of thyroid cancer. Wouldn't you like to know that? That way, when you're in your medical doctor's office one day, if they prescribe a drug to you that's a GLP-1 drug, you would know to look at him and say, hey, doc, I know you're prescribing this drug to me. You must think it's good for me, but do you think I should have thyroid cancer? Do you think that, hey, doc, is thyroid cancer right for me? Is that why you're recommending this? In the bottom left, you'll see a little bottom left on the screen in this infographic, you'll see nationwide population-based study on a French database. There was 3 million individuals with type 2 diabetes that were treated with second-line anti-diabetes drugs between 2006 and 2018. As a result of them getting this, they actually set up a control group and then looked at those who developed thyroid cancers. You will see of the 45,000 controlled groups, there was 3,000 people, 2,562 cases of thyroid cancers. They state that these drugs increase the risk of all forms of thyroid cancers. All right, so what are GLP-1 drugs? Well, an example of GLP-1 drugs is a drug called Ozempic. In fact, you'll see this article from Business Insider. It reads, we wouldn't have Ozempic without Gila monsters. They're hunger-regulating venom-inspired weight loss drugs. Well, what weight loss drugs are they talking about? This all correlates to thyroid cancer, by the way. Pay attention. I left the title on top of the screen. This article reads the first 3 paragraphs. We're going to read them together. What does the Gila monster have that we don't have? The key to more effortless weight loss, apparently, says the journalist. It turns out the venom of a small southwestern lizard, the only venomous lizard in America, played a critical role in developing a whole new class of blockbuster anti-obesity drugs called GLP-1s. One of the newest GLP-1s is called semaglutide. It's sold under the brand names Ozempic and Wegovy, and it is taking Hollywood by storm, Ozempic. So I went to a website sponsored by the NIH. You see the NIH at the top left? It's called Daily Med. I highlighted in a red box the label for the drug named Ozempic, which is called semaglutide injection. You take this drug once a week. Look at the warning, the black box warning on drugmed.com. Warning, if you use Ozempic, you have a risk of thyroid C-cell tumors. All right, so if your loved one, or I'm sorry, your medical doctor tells you that you need to take Ozempic or Wegovy because you're overweight or diabetic, just, you know, being overweight is a symptom of hypothyroidism, an underfunctioning thyroid. Hey, I'm gaining weight, doc. I don't understand why. Here, take this drug Ozempic. Well, I want you all to know when they tell you to take that drug, the venom from the Gila monster is in the injection. They're telling you at home to inject yourself with once a week. So inject yourself once a week with Gila monster venom, and it has a risk of increasing your risk for thyroid cancers, all of them, including medullary thyroid cancers, C-cell type tumors, all of them. Ask your doctor when they tell you you're on Ozempic. In fact, anyone out there who has a loved one on Ozempic, please, for the love of God, share with them this presentation or direct them to go online and type in Ozempic and Gila Monster Venom and all of its side effects. I'll tell you a personal story here in just a second. CNN Health reported in October of this year, researchers linked popular weight loss drugs to serious digestive problems for hundreds of thousands of people worldwide. A new study suggests people taking popular injected medications for weight loss, including Wegovy, Ozempic, Saxenda, and Victoza, are all the same four types of GLP-1 drugs, may be at a higher risk for serious digestive problems such as stomach paralysis, pancreatitis, which is extremely painful, and bowel obstructions compared with those taking other types of weight loss medications. If your doctor prescribes Ozempic or Wegovy, ask your doctor if he or she believes you are overweight and diabetic because you are Gila Monster Venom deficient. You see the Gila Monster Venom there. You see Ozempic in the middle. That's the once a week injection of Gila Monster Venom in a convenient little tube that you pay thousands of dollars monthly for. And if your doctor prescribes Ozempic or Wegovy, ask him if thyroid cancer, a paralyzed stomach, and paralyzed intestines and kidney failure are right for you. Why do I say that? Because Ozempic has thyroid cancer as a black box warning, paralyzed stomachs and intestines as a warning now by the FDA, and it is published to cause acute and chronic lifelong kidney failure and liver failure. So anybody you know that's on Ozempic, just know, ask them if they believe cancer, paralyzed stomachs and intestines, cyclic vomiting as a result, and kidney failure are right for them, because that's what's going to happen if they take Ozempic. Gila Monster Venom in all venoms causes cancer. All of them cause paralysis. In this case, Gila Monster Venom causes paralyzed stomachs and kidney failure. All right, now that's the end of that presentation. I'm going to stop here. My best friend last week called me. Now, this dear friend of mine has been a friend of mine for like 12 years. He is overweight and he is diabetic. Unfortunately, he called me and told me that he was feeling awful last week. And I asked him what was different. This is exactly what he told me. From overnight, from the day before, he had gained 12 pounds of weight from the time he went to bed, from the time he woke up the next morning. And during this entire day, he had had nausea and was vomiting multiple times. And he didn't know why, but he had put on 12 pounds overnight, and he was really, really worried because he'd been doing a great job for the last couple of years losing weight. So I asked him what was different. And he said, oh, I went and saw my medical doctor yesterday, and he prescribed something to me. And I asked him, what were you prescribed? And he said Ozempic. And I remember thinking, I guess he didn't watch my shows over the last 6 months, because I have done multiple shows over that drug. In fact, I thought maybe he was incorrect in his speaking on the drug and got it wrong. No way in my entire life would I have ever thought that he was actually taking Ozempic. So I listened to him for a little bit, describe what the MD told him how to take it. He took it one day. The very next day is when he's calling me. So I waited about 20 minutes listening to him, only to have, and then I asked him at the end of his speaking, I said, after he reviewed the whole day's activities and his upsets, and I said, can you please tell me again what the name of the drug is that you injected inside of yourself yesterday? And he said it. He said Ozempic. And I said, can you spell it for me? And he spelled it. And I said, buddy, have you not been watching my stuff for the last 6 months? And that's fine. All of us are busy. Not all of us are all paying attention to everything we're doing. And he said, why? What do you know about Ozempic? And I said, buddy, the Ozempic, I said, I want you to open up your text messages. I just sent you 3 articles. The first article I sent him just a few days ago was the Business Insider article I just showed you, that Ozempic comes from Gila Monster Venom. He did not know that. He had not seen my presentations or seen my reviews and my social media posts about this drug, which is okay. But then it made him really upset, especially with the next 2 articles, and both of them were CNN articles. One was that, when I just showed you guys, is that the drugs Wegovy and Ozempic are causing hundreds of thousands of people worldwide to have paralyzed intestines and stomach problems, leading to nausea and cyclic vomiting. They can't stop vomiting all the time. Now, this is what he's felt the last 24 hours since taking the drug. And then I sent him another article from CNN in June of last year, 2023. And that article's title is Blockbuster Weight Loss and Diabetes Drugs is Causing Paralyzed Stomachs. And I had him read on the phone the very first paragraph of a person who took Ozempic just a few times and who 2 years later still couldn't go to work, couldn't take care of their family because they threw up all day long after stopping Ozempic a year and a half earlier. So the detrimental effects of the venoms in the human body is creating long-term side effects, just like the venoms of COVID, causing long hauler COVID symptoms. Venoms don't leave the body unless you destroy them. They can stay in the body for up to 10 years. So I sent him these articles. It made him really upset. He said he's going to throw Ozempic away. And I said, don't throw it away. I want you to save it in your fridge. I'm going to come and get it. So now I have a bunch of injections of Ozempic, and I cannot wait to test these drugs, and I will have them tested. I want to know everything that's in them. There might be other stuff besides Gila monster venom, and I want to know. So I have them in my fridge. My buddy called me just yesterday, and you know what he said? He has somebody he does business with, and this individual called him and was telling him that he has a friend who told him he lost 30 pounds of weight in the last 6 months. And the friend of my friend is asking his friend, what are you doing? And he said, I'm doing a drug called Ozempic. The friend of my friend who does business with him is telling my buddy that he just started taking Ozempic a couple weeks earlier. My buddy sent him the same 3 articles I sent him that I just showed you 2 of in this show. He sent those to his buddy who just started Ozempic. And he was so upset about those 3 articles that he called his medical doctor. And he said, I'm going to send you 3 articles that my friend just sent me. This is this week, by the way. He said, I'm going to send you these 3 articles, medical doctor who prescribed the Ozempic. And he said, did you know this about this drug? And the medical doctor, I just found out yesterday, told his patient, oh my God, I had no idea that's what Ozempic was. He had no idea Ozempic came from venom of a Gila monster. The medical doctor who said take the drug and wrote the prescription had no idea it's been paralyzing stomachs of people worldwide and that it had a thyroid cancer black box warning. So the patient says to the MD, you didn't know that this was from Gila monster venom? You didn't know it causes cancer and you didn't know it paralyzes people's stomachs? And he said, no. And he said, don't take any more of that drug. The MD said, don't take that drug. And I'm not going to tell any of my other patients to take it either. When I just said to you, it's important for you to share this information. Medical professionals are not being told what's in the drugs or what the drugs are being made from, that the pharmaceutical drug reps are telling the medical doctors to sell, and you'll make lots of money selling our drug. Oh, and it's FDA approved. There are no medical doctors, except for those listening to the Dr. Ardis show, who are aware that Ozempic is, medical doctors are telling their patients to inject themselves at home every single week with Gila monster venom. That within 1 to 3 years, you're guaranteed to develop thyroid cancer from that venom. You're also guaranteed a higher risk for developing paralyzed intestines for years that will wreck your entire life. This show, you need to tell all your loved ones to stop Ozempic and educate your medical doctors on what it is and share this with all of them. This show is being brought to you by Iodine. Iodine deficiency leads to a dysfunctional thyroid problem. This show is being brought to you by Selenium. This show is being brought to you by Thyroid Complete that has both iodine from kelp in it and other products to help heal your thyroid, and Zinc Plus. Why? Because Zinc Plus has zinc and copper in it, selenium and iodine, and then your thyroid support. That is the Dr. Ardis show. That is how you're going to start addressing reversing thyroid conditions for yourself, preventing them or reversing them, and for all those at home that you love and abroad. And please share this far and wide. No one needs to be struggling with thyroid conditions, and not a single individual is deficient in Gila monster venom or thyroxine prescription drugs, which is the only thing 80% of all doctors in this country are prescribing. I'm Dr. Ardis. God bless you. You've been warned. I love you, and I'm grateful for all of you. We'll see you next week.